Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Abacavir. Its brand name is Ziagen. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Abacavir. We'll then touch on an example of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Abacavir is a synthetic carbocyclic nucleoside analog and has an active form of carbovir triphosphate. The active form is incorporated into viral DNA, thereby inhibiting the activity of HIV-1 reverse transcriptase. This action terminates viral DNA growth. In terms of indications or reasons we would prescribe this medication to a patient, well, we would often see it used in the treatment of an HIV infection. With respect to contraindications or reasons we would not be able to prescribe Abacavir, well, first of all, we wouldn't give this medication to a patient who had a hypersensitivity to Abacavir or to any other component of the formulation. If a patient had moderate or severe hepatic or liver impairment, they would not use this medication, as well as patients that are positive for the HLA-B5701 allele. Now, for an example of dosing with this medication, so in the treatment of an HIV infection, we would typically either see 300 milligrams given orally twice daily, or 600 milligrams orally once daily. As with all medications, there are some side effects or adverse reactions that patients may experience while using Abacavir, so we'll go over some of those here now. 7% of patients may experience a rash, while 7 to 19% may experience nausea. A headache seems to happen 7 to 13% of the time, and a sleep disorder may happen in 10% of patients. Some patients may experience an upper respiratory infection at a rate of 5%, and fatigue happens between 7 and 12%. A fever may happen 6 to 9% of the time. Now, some more rare but serious side effects would be a disorder of the cardiovascular system, a myocardial infarction or a heart attack, Stevens-Johnson syndrome, or toxic epidermal necrolysis. Alright everybody, that's all we're going to talk about today with Abacavir or Ziagen. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.